I'm mindful we have about 10 minutes left, and I'm going to ask a question that might take 10 months to answer. People are interested in knowing your opinions on what effect the media and political involvement may have had in terms of public perception around CCSVI, and I wonder if I could expand that question to ask you this as well. What do you counsel your patients to do to help them understand how to interpret what they may hear or see in the media? So it's a bit open-ended, but I think I'm looking for think of us as in your clinic and us coming saying, what am I supposed to believe?
Right. So I'll start with the counseling patients. So my approach to counseling patients is very much similar to the approach that I presented today, in that I explain to patients the evidence from the scientific perspective about what we understand and what we don't understand. In terms of what role has the media played, I think the media has played quite a significant role in making the procedure sound very simple and the solution also very simple and very effective. And I think that has moved things along rather quickly in terms of raising the bar for expectation and for hope. And it saddens me to see the rise and fall of hope as the more detailed and accurate facts are more carefully distributed. And I do feel that we have responsibility to continually work with the public and the media to relay the facts as we know them.
Okay.
So, Dr. Zamboni's hypothesis and his study would be at best classified as a pilot study. It's a new idea, and new ideas are always welcome in multiple sclerosis, because if you were to ask me or other neurologists who also do a lot of research in the world of multiple sclerosis, what is the cause of MS? We don't know it. We know it's the immune system that does the damage, but if you were to ask what makes the immune system go awry, we don't know. So we're always open to ideas that might unsolve this mystery. But in the way the research evolves, when there's a pilot study or a new idea, it is presented at a medical conference where other people ask pertinent questions of this investigator, i.e., well, how do you do ultrasound of the veins? Because normally that's not done. What's the technique? What did you find? So they'd find all kinds of questions, and then some other researchers in other countries on larger number of patients would try to replicate it. This is exactly what happens in science, in research, is that there's an idea, and then someone else tries to replicate it. And by replicating it, validates the original idea, but not only that, also validates what is the best test. That period typically is 2 to 5 years. And those years, generally, the public don't know about these pilots. You think this is the only pilot? There have been many, and there are evolving pilots as we speak. But because this got out, so the media did something that it got out to the public, it's a half-baked story. Okay? And so without the due diligence, and I would have expected, and it was CTV that brought the news, I would have expected the CTV to have an opinion from a neurologist, an opinion from a vascular imaging person on the feasibility of what Dr. Zamboni is saying. A very comprehensive review might have been helpful. It also would have been helpful not just to put the microphone on a couple of patients that were running marathons now, but what about the chronic progressive MS patients that Dr. Knox has just shown you from his paper clearly didn't improve? Nobody stopped using a cane or a walker in that group. If that had been shown on TV, we wouldn't have patients who are in that stage of MS going to all kinds of places, and at what cost and effort, and now we're learning risks as well. So absolutely, there's a big story here that sometime in the future will be told. I must also say that we're living in times where news spreads like that. the power of the internet is there, the blogs and all of that stuff. So I think this is, it just happened to be in the world of MS. It may happen in other disciplines as well. We have to learn how to better manage this. So far, it's been very, very difficult. And I'm not saying difficult for me, I'm talking about difficult for patients and families, because they come and talk to me, I tell them the facts, they didn't know the facts at all, they say, oh, okay, and then a month later I get a call again that I'm going. And that's because of pressure from family, friends, neighbors, and whoever.
Thank you. We have time for one more question. And it's a question about symptom management. So let me frame it this way. What are the 2 or 3 most important stories about what's going to be new and next in terms of symptom management options?
Well, I think the famotidine, 4-aminopyridine, is very exciting. It's the first drug that has come to the front that has improved walking speed in a subset of MS patients who were found to respond. And I think that is very exciting. I also think in the area of urology, we're seeing newer products on the market that are more specific to the bladder and less likely to have cognitive side effects in terms of managing urgency and frequency with neurogenic bladder in MS. And we are seeing on the market some newer medications for spasticity, other options other than Botox, which is delivered intramuscularly, and in recent years, tizanidine to add to baclofen. So I think there's been some developments in the symptomatic end of things, but I think we have a long way to go. I think that we could use some more developments in the area of symptomatic management.
I could just add on that Botox in select circumstances is being helpful for some patients with spasticity, some patients with certain types of pain, and in fact, even in the bladder, we're currently involved in a bladder study where injecting Botox helps with bladder symptoms. So, but yet a whole lot needs to be done in the symptom treatment as well, and especially the commonest symptom being fatigue. We'd like to know how to treat that better.